you, Ada. I believe Sister Claudette is she's already in the room. And Sister Claudette, as I said, she's from Kenya. She's actually my niece. She's actually my niece, and she's an advocate of the court. Claudette, just clarify the difference between an advocate and a lawyer. Is it the same? Are they different? Before you start your talk, have I introduced you in the right way? Should I say you're a lawyer or should I say you're an advocate?
I am both.
You're both. So it's the same thing or there's a difference?
There's a difference.
So what's the difference?
The difference is a lawyer is anyone who has studied law, while an advocate is someone who is permitted to practice law, who's gone through the school of law and accredited to practice law.
Ah, so you haven't, if you have not only learned law, you are also accredited, yes, to practice. So you're practicing your profession. Okay, I've learned something today. So anyway, thank you so much for the time you've given us. And I think the topic is one. I see many people have logged in. It's a common problem amongst females, amongst men too, but amongst females, that it becomes almost a thorn that you live with. Yeah. UTI, candidiasis, those are things that are very common. And so I'm glad that you've taken the time to just talk about it, and I'm sure we'll all be enlightened. So thank you, Sister Claudette, and the floor is yours.
Thank you, Ma'am Dorcas. I am privileged to be here. I'm humbled, and I'll just take us through oh, sorry, my video is not on. I hope now you can see me. I'll just take you through the UTIs and the natural remedies. All of us desire to stay in a healthy state. And one of the problems, major problems, especially for ladies and for women, is UTI. What is UTI? UTI is basically urinary tract infection. Urinary tract infection, yes. And the urinary, sorry, forgive my pronunciation, the urinary tract infection affects any part of the urinary tract, which includes the kidneys, the uterus, the bladder, or the urethra. Mostly it is caused by a bacteria. The bacteria that come from a minute. Sorry for that. The bacteria mostly are normally found in our digestive system, and then they find their way into the urinary tract, which is not healthy for them. That is not the environment that they're supposed to be found in. The UTI affects both men and women, that is both female and male, but mostly women are prone to be getting the UTIs. This is explained because they have a longer urethra than men, and that's why they can give a longer, how do I say it, a longer environment, surface area for the bacteria to stay in. And it also makes it easier the longer it is, it makes it easier for them to stick there and also to find their way into the bladder. The symptoms for the UTI are normally a burning sensation when you go to release yourself, especially for a long call, for a short call, or a discomfort during the urination. And also it causes you to have frequent urination or even the urgency, like you feel like, I want to pee right now, I can't wait. And also, either your urine will be either dark and cloudy, or can be cloudy or dark, and it has a strong odor. Definitely, when your urine has a strong odor or has a deep color, that means you're unhealthy, and not generally, because it means you're not hydrating well. And one of the reasons as to why UTI will be rampant is because when someone is not well hydrated and they're not drinking water frequently, and also infrequent visiting of the washroom. You need to release the bowels more frequently so that it doesn't stay and hold any bacteria. At times you'll have pelvic pain, or even at times you'll feel that the bladder has not completely been emptied when you use the washroom, and you feel like your bladder has not yet been emptied fully. Those are symptoms of UTIs. There are times you might have a low fever or even blood in the urine. Or at times you might want to go to pee, but as you get to the washroom, there's nothing that comes out. That's a sign of UTI. Or you might even feel like pressure on your abdomen or on your pelvis. I'll want to further get into deeper symptoms for the bladder infection and for the kidney. And we get to know that it's dangerous for us to leave the UTI get to the point that it gets to the kidney, because the kidney is part of the urinary tract. So it's good for us to be able to prevent getting the UTI fast. And if perchance someone gets the UTI, we deal with it before it gets to the kidneys. So for the bladder infection, mostly of all the symptoms that I have said above are mostly found also in the bladder infection. And at times you may not be able to, being unable to void much of the urine. You may go pee a bit, but not all of it. And when it gets to the kidney, you might even have a backache or even pain on the side. You might even have a high fever or nausea or vomiting. The nausea can lead to vomiting, and fever can also lead you to having chills. And therefore, someone should look out at the combination of these symptoms for them to be able to know whether they have a UTI. At times, a test is done to ascertain that you're having a UTI if you go for testing. At times, you might also have acute back pains or even pain in your groin if you're having a UTI. So those are the symptoms of UTI, and mostly for people who don't drink a lot of water, they are more susceptible to getting the UTIs. Research has shown that an estimated 22% of women receiving antibiotics for treatment of UTI develop candida overgrowth after some time. And we need to be able to curb this by treating it in the proper way, because most of the people will run for an antibiotic from hospital or from the over the counter because they are having a UTI, not knowing that they are interfering with their system. Because as we know, an infection in a healthy person, our bodies are technically equipped to fight or to resolve a UTI on its own. If only we keep ourselves healthy and our immune strong, then our bodies are able to treat the UTI by itself. But once we get to rush for the antibiotics, then we interfere with the way our bodies and our immune systems are wired to fight the UTI on its own. And it's also, a research also found that an estimated 25 to 42% of the UTIs can be resolved without conventional treatment. And this is a high percentage, and which I know it can go higher than that if this information is circulated to many people that do not know it yet. Sorry. Okay, so I'll give some few facts, and then we get into how we can treat UTIs naturally. Most of the times, ladies will ask, why do I keep on getting the UTIs? Why do they reoccur? It is because either you had initially gotten it and it was not properly treated, and or the antibiotic that you were given, as I earlier said, interfered with the system, and therefore, even if you're given any other antibiotic, it will not be able to fight the UTI. This is because the bacteria has become resistant to the antibiotic that most of us are given. And then something also that is important that I had mentioned earlier, it is that it is important to start treating or even preventing the UTI for it to avoid getting into the kidneys, because we understand that the kidney is a very important organ in our bodies. And if we have kidney failure, then it's also, scientists also say that it's one of the organs that the immune system doesn't get into. So we need to protect our kidneys as best as we can. Remember, it is one of the organs that cleanses our bodies and keeps our bodies healthy. Then if it fails, then our bodies will have all the junk and all the dirty things, and therefore our immune system will be weakened and will not be able to fight any other diseases, or most of the diseases that we can get. So into how we are going to be treating the UTIs. First of all, the garlic is a very important, is it food or is it, I don't know whether to call it a food, but it's a very important remedy for us as medical missionaries. And we know that it is a powerful antibiotic, and with its antibacterial, antiviral properties, it is needed to be included in our diets. However, we can use it as medicine. That is, we mix the 2 cloves of garlic and 1 bulb of onion, and then make the juice and take it. That will be proper for us. Vitamin C is something also very important for us because it helps in boosting our immune system. And remember, we had initially said that our bodies can fight the UTI by itself because our immune system is wired in such a way that it can fight by itself. So therefore, vitamin C helps in boosting our immune system, and sources of vitamin C are sources like citrus fruit, strawberries, potatoes, broccoli. We all know the sources of vitamin C, and therefore we need to increase the intake of our vitamin C so that we can help in treating of the UTI and also making our bodies, our immune system stronger to fight them. It is said that vitamin C helps in treatment of the bladder infection by making the urine more acidic, which could inhibit bacterial growth. And also something else, the UTI is more pregnant women are more prone to UTI. I don't know why, but this is also good news that you can still use vitamin C and natural remedies to cure the UTI. Don't hassle of going for the conventional treatment. We also have cranberry that is used to treat and wash out the UTI, the bacteria in the urinary tract. Drinking the unsweetened juice of cranberry helps in preventing bacteria from clinging on the urinary tract. And it is also used as a long-term prevention. The other thing is when you feel like going to the washroom or releasing your boils, please do not hold onto it, because the longer you hold, especially if you are having a UTI, the longer the bacteria stays, and therefore going to the loo to pee helps you flush out the bacteria. So when you flush out, the faster you do it, the better. And the other thing, drink a lot of water. Water. That is one thing that is important for us. Water is very important because it flushes out. The more you drink, the more you flush out. There's someone I had the other day saying that, I've drank too much water, I'm overworking the kidneys. There's no time that you will overwork your kidneys simply by drinking water. You need to know how much water you need to drink according to your weight. That is also important. The other thing is for especially ladies, when you use it, after bathing, after using the loo, make sure that you dry the groin area very well so that it doesn't stay moisturized. The bacteria stays in a moisturized, loves staying in a moisturized area, and it thrives and grows in such an area. You give it an environment that is conducive for it to grow and thrive. And therefore, it is important that we avoid keeping the groin area moisturized. After having a shower, make sure that it is dry. After you have had, you've done your exercise, make sure that it is dry. After you've used the toilet, make sure that it is dry. Even the clothes that we wear, that's why we are told to avoid tight clothes. We need to put on clothes that let air flow, because if you put on tight air.
Claudette Obat.
Sorry for my background again. So avoid wearing tight clothes. That causes moisture to gather in around the groin area, and also the type of inner clothes that you put on. Cotton is advisable because cotton helps in absorbing any moisture that might have accumulated around the groin area. I think I am done for today. If there are any questions, they are welcome.
Praise God for a wonderful presentation. Advocate Claudette, praise God.
Welcome, praise God, praise God.
Thank you, Claudette. Thank you for, as Siphiwe said, for that good presentation. Now, there are a few questions. I think there's one. I've seen someone typing. Can someone kindly type the ingredients that she was mentioning for infections or inflammations? Could you kindly repeat that, Claudette? The ingredients for infection or inflammation.
Ingredients for infection or inflammation. Okay, I remember saying that vitamin C is good, and the sources of vitamin C, citrus fruits, strawberries, potatoes, black currant, broccoli. The list is just long. And then I also said garlic is also important because it's an antibacterial. I said that vitamin C is good because it helps in boosting the system, the immune system, and the immune system is able to fight the UTI by itself. The garlic is used because it's an antibiotic, and therefore it is a healthy remedy to flush out the bacteria that is already accumulated into the urinary tract. Yes.
Okay. People are asking about the recordings. There's a link that has been shared on our post on our chat. You can look into that. Yes, if you want the recordings. Anybody else with any other question? Just reiterating what Sister Claudette has said. Water, very important. Water by itself, by the way, can help to clear, because the more concentrated, the more retain urine, number one, the more concentrated that urine is, the more the bacteria have to saturate the bladder, because your UTI is affecting your bladder and maybe your urethra. So I'm saying this because one of the symptoms of urinary tract infection is frequency. That means you want to go to the toilet frequently. Yes, but a lot of times someone might go, as they may feel like they need to go, and when they go, there's literally nothing. But also, as far as the mind is concerned, they'll be fearful of drinking water because they don't want to go all the time. But that is counterproductive, because then they'll become dehydrated and the bacteria will become more concentrated. Yeah. So as paradoxical as it may seem, to more water, it will actually help that the system can let you go and you can flush out those bacteria rather than them congesting your bladder and multiplying. So don't forget that water, very, very important. Yeah? And then the anti-inflammatories. And as I said, water by itself, if it was a mild infection, we'll wash it out. Because as soon as you go once, twice, thrice, and then the bulk of the bacteria is removed, then you're good to go. Or you may need to up it to other things like the anti-inflammatories. Yeah? And you can take the normal garlic onion we use for other things. Your 2 cloves of garlic and 1 ball of onion. You can drink, but you can also use it locally. Do a sitz bath. Put that mixture into your water. Sit in it for about 15 minutes. It will sting, yes, for a few minutes. Then it will relieve, yes. And you can actually use charcoal also. Again, if it's a milder infection, charcoal can also work very effectively, especially if there's a lot of irritation. You can actually put a cup of charcoal powder into your sitz bath, sit into it and sit still. It will be very soothing, by the way. It'll be cool, and after some minutes, it will help to draw out the inflammatory problems, and it will ease, especially if you have maybe bruising or it's really, really irritating. That can help a lot. So other anti-inflammatories, there are lots of things that are anti-inflammatory. Yes, and she talked also about the source of vitamin C, and that will help to boost the system. As she said earlier, your system has the capability of getting rid of urinary tract infections. So you do those things, and it will help remarkably. And the same thing she has mentioned, you can actually use when you have candidiasis, because I need to mention this. A lot of times, people are treated for urinary tract infections focusing on bacteria, and there are many times when the problem is actually fungi. Yes, one, because of the people eating a lot of fungus, but also medications given in hospitals are our antibacterials, and antibacterials kill the bacteria but will make the, yes, so you are replacing one pathogen with a worse one. Yes, because antibacterials themselves are largely made from fungi, from mold. Yeah, that's why they're from the penicillin family. They're the antibiotics. They are mainly from the penicillin family, and those are products of mold. So they are so strong, they will kill the bacteria, but they'll now allow for the fungi to thrive. So you move from a bacterial infection and you get into a fungal infection, which a lot of times is even harder to get rid of. And that's why you might have a history of someone who has had UTI for so long and have taken antibiotics for so long. And the condition is not going, it is now they're using conventional medications, then the antibiotics, which are based on, which are actually antibacterials, they focus on killing bacteria, now won't work on the fungi. But the good thing with the natural remedies, they are broader utility. So you find your garlic, it will work against bacteria if it is bacteria. If it's a viral infection, it will work against that. If it is fungal, it will work against that. So it has a broader utility. So it is it is more remarkable as far as working to help in that area.
May I ask a question?
I see there are a number of other questions.
Yes.
Yes.
If somebody, I know somebody who has had that UTI for a long time, a young girl who is about 24 years now, and she's had it recurring again and again. And I think every time she gets it, she goes for medical, then she goes for conventional treatment, and it keeps recurring. So I was wondering, in her case now, if she has to use garlic and bulb and these other things, of course, maybe you need to give us not the ratios, but how many times and how long? And how is it? I mean, you put it in hot water, how much, what, those ratios, and how long the period?
Okay. Now, as I said, that is the scenario we're speaking about, that moving from bacteria to fungus, so that the medication being given is not effective anymore. So, Sister or Advocate Claudette, you'd want to tell them what ratios to use, or you want me to go through that?
The ratio is one bulb onion to two cloves of garlic. That's the ratio in warm water, in one glass of water. Then they can take the drink. They can do that twice a day, morning and evening. For the seed baths, and Ma'am Dorcas, you can lead us.
The same ratio of 2 to 1, but for every liter of water you use 2 cloves to 2 cloves of garlic to 1 bulb of onion. That means if someone who's more endowed and you'll need more water, then you will up that, yeah, in your sit bath. Then you sit on it for about 15-20 minutes. Now you don't want hot water, but at the same time we don't want discomfort, because sitting in cold water for some people might be a shocker. But we want that garlic as raw as possible, so it can do. Because when you heat it, it loses its antiseptic properties. Yeah, the aspect that helps in dealing with infections. So as raw as possible. So you put it in the water, and then they sit there.
Okay, so for how long? Like what period are we talking about? A week?
For 15
days?
Charcoal powder in the water and sit. Yeah, I'm getting to that. If there's also bruising, you can also alternate with your charcoal to help reduce inflammation. At least it'll help with a lot of bruising. So you can do it from 5 days to 7 days. Yeah, once a day is adequate. Yeah, unless it's very heavily infested, then you may do it twice a day, but once a day usually is very effective. And then, important, very important, the other things that were noted, yeah, that enhance infection. The dressing is already infected, and then the area is restricted, then it encourages the fungi to grow more, or even the bacteria to grow more. Yeah, that is one. And then the diet. Someone has asked in the chats about diet. Someone, if it's fungus, for many germs anyway, they like refined sugars because they don't have digestive systems. So if you have something that's refined for them, it's easy for them to absorb. So when you have an infection, you should keep off sugar. Yes, you should keep off a lot of sweets. And that helps to at least keep the infection under control as you're working to eradicate it. Otherwise, you'll need to put in more effort for a longer period of time to take care of the situation. So keep off the sweets, and then the fungi themselves, keep off them. Yes, because if as I said, if you have a chronic UTI, if you've had a urinary tract infection that has lasted for years, it is probably no longer bacterial. It is usually fungal. Yes. And so removing the fungi, and many people, unfortunately, many women have been taught that the fungi actually helps with the urinary tract infections by putting in more bacteria. Yes, but again, it also inoculates you with more fungi. So keep off the yogurt, keep off the mandazi, keep off the donuts, keep off the bread, and eat fresh. And you'll find that it will resolve very quickly. I see people in this list, if they want, they can share their testimonies. I'm not pushing anybody, but who have had a history of that, and they can tell for sure that it is what you have said has been very helpful. Yeah, because otherwise you keep into a routine of antibiotics, and those antibiotics in themselves have so many other side effects. And of course, in our day and age also, there's increased resistance. And so it's putting harm without giving you any benefits a lot of times. I can see Marilyn, you have a question? Go ahead.
Yes, someone wants, morning, Dr. Dorcas. Somebody wants to know how to treat chronic inflammation.
Okay, there's some static. I can't get you breaking off. There's some background noise.
Carol G should mute her mic.
Okay.
I don't have any background noise. I simply want to find it. Somebody wants to know how to treat chronic inflammation.
Go ahead. So I can only hear the last part, chronic inflammation, but the previous one, the word before chronic inflammation.
Treatment of chronic inflammation.
Treat chronic inflammation. Now, would need to get more. Okay, the anti-inflammatories help to reduce inflammation. Yes. So they are more of a symptomatic stopgap. They all take your paracetamol or whatever. It's a stopgap with less side effects because it's natural remedies. And the anti-inflammatories are many. Yes, there are many green leaves that you have. Your turmeric is an anti-inflammatory. Ginger is an anti-inflammatory. Avocado seed is an anti-inflammatory. Mint is an anti-inflammatory. There are many anti-inflammatories, yeah? But now, if someone has chronic, it means it has been long drawn. And for that matter, we need to know why the chronic inflammation is there and where is it? Is it for our topic of today, or is it chronic inflammation in another part of the body? Because inflammation literally is the body's response. Yes, it's actually the body's response to some invasion. So when someone has arthritis, that's inflammation of the knee. The body is reacting in terms of inflammation. If you cause swelling, there'll be pain, there'll be some deformity sometimes there, and change of color if you're lighter skinned. Those are the 4 cardinal signs for inflammation. But why is the body doing that? It's being provoked by one thing or another. So when we understand why that is happening, yeah, depending on where the inflammation is, then we can work better to completely eradicating it rather than just as a stopgap. Yeah, but those things I've mentioned are very good stopgaps for inflammation. They're very.
Thank you.
Can I add something?
Yes, go ahead.
Can I add something?
Yes, please.
Yes. I don't know whether you talked about, because I had to call my husband during the presentation, actually now during a question and answer. But there is something that can cause that urinary infection, urinary tract infection. Is how you wipe yourself on your private parts. Some people start from the back, especially some women, and come to the front. So it's better to start from the front and backwards, because that could cause a chronic infection, because you still do the same thing, and we know that the back part is, has, its own toxins. So when you wipe yourself as a woman, start from the front backwards, not from the back frontwards.
Yes, that's very important. It had just escaped my mind when I was presenting. This is because initially, as I had earlier indicated, that it's because the bacteria are moving from our anus to the opening to our urinary tract, and therefore it is important, as Ma'am Siphiwe has said, that when we are wiping ourselves, we do it from front back and not the other way around. I can see a hand up. Sis McIntosh, kindly.
Good morning. Happy Sabbath. Suppose you want to detox your body. Detox the body, feel like it want detox. What you use?
I didn't hear you, sis.
Good morning. Suppose, happy Sabbath. Suppose you want to detox the body. You hearing?
No, I
Hello?
can hear you. Yes, I can hear you.
You want to detox the body. What you use to detox?
Okay. Detox. You can use the protocol juice. Protocol juice.
Okay, that's a broad question, yeah, but generally, I'll give you a broad answer because that's a broad question. The leaves for the healing of the nation. So there are many greens that just help to cleanse the system. Some more aggressive than others, yes. But again, it would be good to know what exactly. If it's just general, that's fine. But if you wanted to know, maybe there's a particular thing that is an issue for you, so you can put more focus on that part of the body, that would be better. That will give more focus to whatever we're doing. But basically, as I said, my broad answer is the leaves for the healing of the nation. I know one thing that helps a lot and has helped us numerously for so many cases is the protocol treatment. It helps a lot, yes. But in your locality, if you have green leafies, and I know that people in the local area know certain things that can help, yeah. Some people want to use aloe, it purges very strongly, very strong, or mint, or you can do a mixture of different greens, or even the local greens that you eat. I know, like for female issues, things like amaranthas are very good, yes.
Okay.
Ma'am Dorcas, we can't hear you.
Charcoal is another thing that helps to just bind things.
I think she's logged out of the meeting, but was your question answered?
Yes, Miss. Thanks.
Oh, welcome. Anyone else with a question? Anyone else with a question?
Yes, we have another question. Suppose you have an ears infection. What type of something you use for it?
What?
Ears infection. Ears infection.
Uh-huh.
What type of medicine you use for it?
Ear infection. Most probably, okay. Garlic will be a go-to anytime, but you need to know that for that you might need to do a poultice instead, but in the same ratio. But now you won't do the juicing, you'll do the poultice. Garlic onion poultice. And maybe you can also do the charcoal poultice to help in drying if there are any wounds, to help in drying and getting out any pus or any fluids that are necessary in the ear.
Okay, or you use the garlic and the onion.
You make a poultice, you take the 2 cloves of garlic and onion and mash it, put it in a piece of cloth, a white cloth, and put it in the ear area.
Okay, me. All right, suppose you have a chest infection, like a cold on your chest. What type of